So, PSMA is a molecule, is a receptor which is overexpressed in patients with prostate cancer. Practically all the prostate cancer patients will express PSMA, and the PSMA receptor gets upregulated as the tumor becomes more aggressive. And this becomes a very potent target for us to treat with radioligand therapy, which means that we have radioisotopes which actually target the PSMA receptors on the prostate cancer, and they deliver a high payload of radioactive substance to the prostate cancer, thereby killing these prostate cancer cells and improving the progression-free survival in patients with metastatic prostate cancer. The PSMA receptors can be targeted by various radioisotopes, which may be the beta emitting radioisotopes like lutetium, or the novel alpha emitting isotopes like bismuth or actinium. Now, lutetium is what is used world over. There is a lot of data on the use of lutetium PSMA for the treatment of metastatic prostate cancer, which has become refractory to androgen deprivation therapy as well as to chemotherapy. We started doing lutetium PSMA therapy way back in 2013, just a few months after the first lutetium PSMA therapy was performed in Germany. And since then we treat more than about 300 to 350 new patients every year, and these patients come from various parts of the world, not just from India and from the surrounding countries, but from way around the world in the United States, Canada, some parts of Australia, as well as the European countries. Lutetium therapy is being done at a few select centers across the world, and while the protocols are still being defined, we at our center not only do clinical work with patients, but also try and refine these therapies further. And we are probably one of the few centers in the world which believes in evidence-based, dosimetry-based treatment. And we do a very meticulous dosimetry in all patients who are undergoing lutetium PSMA therapy at our center. And that is the reason why we have over the years been able to escalate the dose, because by doing the dosimetry studies, we know that we are working way within the safe limits, and by escalating the dose, we are actually able to improve the efficacy and give a longer duration of response to patients. And this is possible because we work with a team of researchers who do a lot of very refined and sophisticated algorithms of dosimetry with us. So, we have patients of lutetium therapy almost every week. We typically get our radioisotope every Monday. We source our radioisotopes both from the international suppliers, mainly ITG, ITM in Germany, as well as the Indian lutetium, which is our comes from the Bhabha Atomic Research Center in Mumbai. And we treat our patients typically on the first few days, which is Monday, Tuesday, Wednesday of a week, and go on to do the dosimetry towards the end of the week. So, a typical patient is here with us for about 5 days. The first day we do the assessment, we do the, if it is required, we do a gallium PSMA scan. We discuss every patient in a multidisciplinary tumor board, where not just nuclear medicine physicians, but specialists from the field of medical oncology, radiation oncology and urology are there. We discuss every patient. If there is any other need which the patient has, often patients of prostate cancer will have problems with dysuria or problems of obstruction of flow. All these factors are taken into account before deciding whether a patient is eligible, and then further before actually administering the radioisotope therapy. Lutetium therapy not just extends the survival in patients, but it also improves the quality of life. Improving quality of life not just in reducing pain, but increasing the energy levels, increasing the general sense of well-being. Most patients who undergo lutetium therapy, about 75 to 80% of these patients will show a good response to therapy. There would be about 15 to 20% patients who do not show a good response, and out of the patients who show response, there would be a small subset of patients who would recur early. Typically, patients who undergo lutetium therapy have a duration of response of about a year to year and a half. This is the median duration of response. There would be a group of patients who would have response, who would continue to be in response for much longer than this. My longest surviving patient is almost 6 years, and 6 years post lutetium therapy has continued to be in complete response. However, most patients will have a response of about 1 to 1.5 years from the start of therapy. The more important aspects of lutetium therapy are the improvements in the quality of life which the patient has in terms of reduction in bone pain, reduction in the amount of analgesics and painkillers which the patient has to take, the improvements in energy levels, the improvements in general well-being. Lutetium therapy is fairly well tolerated. There are no severe adverse effects. The most common adverse effect is a dry mouth. There would be about a 10 to 15% reduction in the salivary gland function post lutetium therapy. Some of it is recovers with time, but there would always be a slight deficit in the salivary function post lutetium PSMA therapy. So, typically we give about 4 doses of lutetium, and the lutetium PSMA is administered at intervals of about 2 months. In the interval, patients undergo blood tests which are the routine blood tests which look at the complete blood counts and the liver and kidney function tests, and these tests are then patients send me these reports on email, and I am often in direct contact with the patients at all times by email or by various social media platforms. My team and I, we handhold the patients during this entire journey of their therapy and even beyond that. Many of my patients have stayed in touch with me over years, and we become a part of not just their treatment protocols, but an extended family itself. So, if you have any queries about lutetium PSMA therapy, please get in touch with my team or me, and we would be happy to tell you more about these therapies and to take you on to our program if you need these therapies at all.